Good morning. My name is Brenda Alexander, and I'm the Director of Organizational Effectiveness for St. Mary's Good Samaritan in Southern Illinois, and I'm honored to be here today. I want to share with you an experience I had almost 24 years ago. My mom was in the intensive care unit at a hospital near our hometown. Her condition was terminal, and we knew she wasn't going to be able to come home with us. My youngest sister was 9 at the time. What I remember from that experience, when my mother passed away, my little sister crawled behind a chair in the waiting room and cried. There was a nurse. I don't remember her name, and I don't remember what she looked like, but I remember what she did for my sister. She crawled on the floor behind the chair, and she sat and she cried with my sister. She left me with an impression that I will never forget. What I remember about that experience was not about the clinical care my mom received. I'm sure she got the best care possible. It was about how the staff and that one particular nurse made my family feel. So when we in Southern Illinois started talking about creating an environment where our patients and their families would remember us for the care they received, I couldn't help but remember that lasting impression that I had from 24 years ago. You see, our patients and families expect quality clinical services just as my family did. What does and will continue to set us apart from other organizations is how we provide that care. So we set out to reestablish a patient-focused culture, one that would leave a lasting impression, one patient encounter at a time. We didn't have to recreate the wheel. We had tools readily available to us, utilizing the components of achieving exceptional patient care. During 4-hour training sessions with our staff, we talked about our customers' expectations as they relate to our exceptional service standards. We talked about creating a great first impression, creating memorable experiences, and leaving lasting impressions. We talked about using lead service recovery when we fall short of our customers' expectations, and about reducing the anxiety that all of our patients and families feel through the use of GREAT. Greeting our customers, explaining our role, explaining what we're going to do in terms that they can understand, asking them what questions or concerns they have had, and thanking them for letting us take care of them. I'm happy to report that 98% of our staff attended Lasting Impressions training, and we continue to make progress in improving our patient satisfaction scores. For anyone who works in the healthcare environment, it's important to remember that we often create memories for our patients and their families, and it can be the smallest thing. It can be a simple smile, a gentle touch, a kind word, or even crawling on the floor behind a chair. Thank you.